Hello everyone, my name is Jason Hickox, and today I'm going to be talking to you about methadone. So methadone is a medication used to treat opioid use disorder, or OUD, and is a long-acting full opioid agonist and a Schedule II controlled medication according to SAMHSA 2023. It is commonly used as a treatment for addiction to opioid drugs such as heroin and can also be used to treat chronic pain. It is typically administered through a pill, liquid, or sublingual tablet. And on the bottom left there, you can see that methadose oral concentration, and that is typically what a prescription for methadone would look like. It is safer taken orally than intravenously, like heroin, and because those intravenously taken drugs can cause the risk for diseases such as HIV. It is classed as an opioid agonist, and its brand names are Methadose and Dolafine. Street names are Fizzies, Amadone, and Chocolate Chip Cookies. As for the legality, it is only legal under a doctor's supervision. So, methadone affects the body by activating opioid receptors and stimulating enough to reduce cravings and withdrawal symptoms. Methadone in itself is an opioid. However, unlike heroin, its effects are long-lasting and is typically used once per day. It blocks the action of other opioids when taken simultaneously, and dependency is typical. Overdose is unlikely, however, and it changes the way the brain and nervous system respond to pain by blocking NMDA glutamate receptors for pain relief. And it also activates opioid receptors. And methadone is a synthetic drug that helps reduce opioid cravings. So the risks and consequences for methadone are that it has long-lasting withdrawal symptoms. Unlike short-acting drugs like heroin, methadone's effects are long-lasting, which causes withdrawal symptoms to carry out for a longer period of time. Due to methadone's long-lasting effects, it can take up to 2 days to see the withdrawal symptoms. However, those withdrawal symptoms can carry out longer than 14 days if another administration of the drug is not taken. The onset of withdrawal can be sweating, itchy skin, or sleepiness, and overdose effects include shallow breathing, stomach spasms, clammy skin, convulsions, weak pulse, coma, and even death, according to the DEA in 2023. The history of methadone is that it came to the U.S. in 1947 as a pain reliever, and it was used to treat multiple conditions. Its effectiveness as a narcotic addiction treatment was slowly realized over time. The cost of methadone is about $126 per week, which is about $6,552 per year for patients that are prescribed methadone. The typical dosage prescribed per day is 20 to 30 milligrams. However, a lethal dose can be as little as 50 milligrams. Tolerance does build over time for methadone users. However, the administration is only given by a doctor, so the prescriptions will only advance if the doctor sees fit. Typically with methadone, even though it's used to treat opioid addiction, it in itself is addictive, and you're only replacing one addiction with another. So here are some common trends that we've seen via the CDC data, and this is trends in the United States for overdose deaths, distribution, and diversion reports. These are the trends in the world that we can see with methadone, and as you can see on the top left, the United States and Canada have the highest usage. All of the blue countries have a fairly low usage compared to Canada and the United States. Here are the trends in gender, race, and ethnicity. And as we could see, between 2013 and 2018, there was a spike in non-Hispanic black men with mortality rates related to methadone. And here are some different resources that I've used. The DEA.gov, CDC.gov, and NIH.gov are some good websites to use if you're looking to research methadone, as well as SAMHSA.gov. Alright, thank you so much.